every day and in every way. Enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Urinary tract infection, also known as UTI, is an infection of any part of the urinary system, kidneys, the bladder, or the urethra. Globally, urinary tract infections affect about 150 million people each year, with women being more susceptible due to the anatomical differences. In Africa, recurrent UTIs are common due to poor hygiene, limited access to clean water, and delayed medical care. In Nigeria, studies indicate that urinary tract infections account for a significant percentage of hospital visits, especially among women and children. The symptoms include painful urination, frequent urge to urinate, cloudy urine, and fever. Untreated urinary tract infections can lead to kidney damage. Today on your favorite Health TV talk show, The Physicians, we'll be discussing urinary tract infections, signs and symptoms, the causes, risk factors, management, and of course, prevention. We'll be right back after this time. Do stay tuned. It's another day on your favorite Health TV talk show, The Physicians, where your health is our business. Today we'll be discussing urinary tract infection, the causes, risk factors, signs and symptoms, management, and of course, prevention. My name is Dr. Memuna Yusuf Kadri, and my co-anchor is my guest today on the show. She's no other person than Dr. Martina Agberien, the medical director of Nigerian Television Authority and co-founder of The Physicians.
Thank you, Dr. Mimuna. I'm on the hot seat today. It looks really, really straight.
You are looking so radiant.
Thank you.
And I know you are going to do a lot good to this topic.
Yeah, because it's very close to my heart. Yeah.
Which is urinary tract infection, and you know, with what I said earlier on, affecting over 150 million people
worldwide.
So that means it's very common, and it's something that some people just take for granted. Yeah. So the first thing, for the sake of our viewers, for people to understand this, it sounds so big, urinary tract infection. People usually just say UTI. Yeah. So please, what is urinary tract infection?
Okay, so urinary tract infection is an infection that affects the urinary system. The urinary system is made up of the kidneys. Coming down from the kidneys, you have the urethra. The urethra enters into the bladder. Then from the bladder, which is a pouch, the bag, you now have the urethra. That is the passage through which the urine comes out. So for a man, the urethra passes through the penis, okay? But for the females, it's quite short. So you will not be able to see it in female, but unlike the men, it is outside. So you talked about it being worldwide. It's about 150 million that are affected globally annually. But of course, in Nigeria, we really do not have the real statistics. But we know it's very common, and it's one of the major reasons why people, especially females, visit hospitals for care. So that is basically the urinary tract infection.
So from what you're saying, the reason why women are more susceptible to urinary tract infection, because the urethra, which is part of the urinary tract system, is shorter in women. It's
shorter in women because of the anatomy.
Because
of our anatomy. So
like the men that is outside. So now, what are the most common symptoms? Because you said it starts from the, kidneys, the urethra, the bladder, then the urethra. Okay. So that means this is a whole spectrum now.
Okay, yeah. So what happens is that we can first of all give a general symptom, the presentation, because it doesn't really come with symptoms. But when it comes with symptoms, some of them that are noticeable, the burning sensation, the urge to pass urine frequently. And when you go to pass the urine, it's usually short, small volume. Okay, but you have that urge to pass urine, but there's nothing there. And when you now go to pass the urine, it's usually very small. So you feel to say yourself, the frequency is there. Then you now have, at the end of the urine, when you're maturating, towards the end, you have this excruciating pain. Some of the patients will tell you a sweet, sharp pain at the end.
Sweet, sharp?
Yes,
what
it's
kind of...
sweet, that is, it holds them, and then it releases, okay? But it's sharp, okay? So that is how the gel will present. Then the cloudiness of the urine, and it can be foul, can be offensive, and you have, it often comes with fever. So that is generally the general symptoms that it present with. So, but let's take it from looking at the different compartments.
Exactly.
From the kidneys, so we can actually understand it. From the kidneys going to the bladder and the urethra. So from the kidney itself, Lord, when it happens, you can have pain at the side, back pain, side pain, where the kidneys are. Then you can also have, and that's at the back and at the side, you can have that pain. You can also have fever. You can have fever with chills and rigors. You can have vomiting. You can have nausea. We always say it is not good to wait until it gets to that stage, because when infection starts, it starts from the bottom. Okay, we'll talk about that one from the causes. Then you now let's go to the bladder now. That is where we place our houses, the urine. You have lower abdominal pain around the pelvic region, lower abdominal pain.
Because of the location of the bladder.
Because of the location of the bladder. Then you also have that urge to pass urine, okay? Then you can also come down with fever, okay? Yes.
Because it's an infection.
Because it's an infection. Then around the pelvic region, the lower abdomen, okay? You have pain. Then now take it to the urethra. Where you have the urethra, that's where that sharp pain comes from. It can be very annoying and discomforting. Then at times you even have blood come with it. You can have blood also coming with it, yeah.
Wow, that is very severe.
Yes, because it has gotten to the stage whereby the infection is high up there. So you can have blood coming with it. They also have cloudy urine. The urine can be cloudy, can also be very offensive. So those are some of the symptoms that come with it. But you have all these ones mainly in the females. Like I said much earlier, because of the anatomy of the female. So how does it happen? Maybe that should take us to the causes, right?
Exactly.
So how does infection happen? It's mainly because of a bacteria. It's called the Escherichia coli. In some just the E. coli for short, okay? And that E. coli is found in the gastrointestinal system, in the GI tract, right? So it's like a normal thing. But unfortunately, the anatomy of the woman, where the urethra is closer to the back passage. For females, it's closer to the back passage. Unlike in males, where the urethra is outside. Okay? Because it's closer to the back passage. When they use the restroom, the tendency is for them to go and to clean back up. Normally, you should clean from front to the back. But most of them will clean from the back passage or from the front. And because the E. coli is part of the gastrointestinal system, the chances are that you are going to pass it up.
Move the bacteria forward.
Yes, because the small opening of the urethra is so close to where you have the back passage.
So will you say at this point that it's best people use water to clean?
There's nothing as...
Because people use this tissue. Give me
water
tissue.
Is the best. Water is the best. Is best to use, right? But now people have realized that water is best. So even if when you travel, go out to the restroom, you now have a place where they make provision for where you can use the water instead of using the tissue called hem. So that is one of the reasons, right? Passing the E. coli, the organism, the bacteria down to your urethra. Another thing is most women, because of their anatomy, right? Some of them would actually go and use this feminine creams, douching, yes, and they also move it in. That is the reason why you can also have it. Then sex. Sex is another risk factor for having urinary tract infection. That is because of the location of the urethra, okay? And it's easier for the male to move the organism to the woman from the back passage, okay? Then another reason why you also have urinary tract infection, some people will use lubricants.
Okay.
Some use condoms, lubricants, and they probably will not even lubricate the condom. They will use it that way. So it also passes for the woman. So those are some of the reasons why you can have urinary tract infection. Then also talking about dehydration. If you don't rehydrate properly, the tendency is for the urine to remain there for a long time. And if your urine remains there for a long time, the chances are that bacteria will begin to breed, okay? And you now come down with urinary tract infection.
Let me take you back to something you made mention of earlier. You said the urine is cloudy.
Yeah.
Right. Are there other times that there's a different color of the urine, whether gender, whether the women presenting with a different color or the men presenting with a different color?
You can have it can smell like fishy. It can be fishy. The odor can be fishy, and it can be sometimes a bit greenish. At times you also have the urine looking yellowish, very dark yellowish, color-colored urine. Okay. That shows that it's probably coming from the kidneys.
Kidneys.
Yes. So it means there's blood in the urine. It means there's blood in the urine. So that is.
So if there's bloody urine, it's more coming up from up.
Yes, from up. So the truth is that when there's a urinary tract infection, it starts from the urethra.
Okay.
So you just look at it in this way. The organism goes through the urethra, ascends up to the bladder. And if it's not properly taken care of, from the bladder, it ascends through the ureters and goes to the kidney.
Now our audience, they have called neighbors. They have said, come and listen, oh, that thing that was doing you, that you're having pain at your side, and you're thinking village people are doing it. It's not village people, it was urinary tract infection. The doctor has said it. If you miss it, go and watch it on their YouTube. It's right there. How do you treat urinary tract infection?
Okay, so before we talk about treatment, I want to also, because you talked about the females, right?
Exactly.
I want us to also remember that another factor is menopause. So menopause is also another factor, because when you're menopausal, the estrogen, the female hormone, the estrogen is reduced. And when the estrogen is reduced in circulation, it causes changes in the urinary tract. And that actually
so menopausal women are more at risk of urinary.
Yes, yes.
What did they do?
Because of the estrogen. That is why you're a woman. Okay. Then other risk factors, right, that are also include the urinary tract problems, maybe from birth.
Okay.
Yes, from birth. Babies are born with that urinary tract challenge, will tend to come down with urinary tract infection of the urethra, because the urine will now, from urethra it backs up to the bladder, the kidneys, and the other factor is the blockage in the urinary tract. How do you have blockage in the urinary tract? For men, because of the enlarged prostate. Because remember, the prostate is just at the back of the urethra. So if the prostate is enlarged, the chances are that you won't have a free flow of urine.
Narrow the urethra.
To narrow the urethra, and you now have the backlog there. So you are now at risk of having a urinary tract infection. Another one is suppressed immunity. If your immune system is suppressed, right, you're also, like from diabetes.
Exactly.
Yes, you're going to have,
if you have other medical conditions.
Other medical conditions affecting the immune system. Diabetes and can lower your immunity, and you also come down with, they can have a urinary tract infection. Then in hospitals, apart from in hospitals, in patients that are unable to pass urine frequently, they have the need to use a catheter. The elderly people that use catheter, they're also prone to have a urinary tract infection. Because the catheter on its own staying there for a long time, and you're not even changing it, is a foreign body, and the organism, microorganism can also be there. Then a recent urinary tract procedure can also have urinary tract infection. So now talking about the treatment, maybe I will talk about the treatment or the complications.
No,
we'll talk about the treatment.
Treatment then, of course, if it's not well treated or you didn't treat at all.
Beautiful. So for treatment, right, first and foremost, you have to take, they will do the normal investigation, urine for urinalysis, culture, everything. Then, so it depends on the cause, or where the problem is. Remember I talked about it in the kidneys, in the urethra, in the kidneys, in the urethra, and the bladder. Okay, so if it's the E. coli, if the organisms are responsible, they will give you antibiotics. There's a room for antibiotics treatment, but the investigation that you also do will also include an ultrasound scan to be sure if there is no deformity. Okay, in the urinary system. So it's a room for antibiotics. Then one other beautiful thing that you can also do, first, is to increase the water intake. You need to rehydrate as much as possible. So even if you don't have a urinary tract infection, it's always advisable to take at least 3.5 liters of water a day. That is recommended. So for urinary tract infection, you should take as much water as possible. That will help to dilute whatever urine is, and also help to pass a lot of the organisms away. Then that is for use of water. Then for females that do a lot of douching, using creams, all those things are not important. You try as much as possible to also eliminate them, stop using them, because the chances of taking in the organism is high.
Or even destroying the normal body.
Flora is also there. Then using spermicides and all those ones there. So even using the condom, using condom without lubricant, you also pass it, right? Then for females that also use the female condom, the diaphragm, it also helps to pass the infection. So we advise that you do not use it as much as possible. But the important thing is the medications that they give to you, and seeing the doctor, the rehydrating properly. Then moving from one partner to the other is that you are highly at risk of having urinary tract infection. So limit your spouse. You have to be
stick to one partner. That's what you should just
stick to one partner. Stick to one partner. So when you're having multiple partners, you are highly at risk. So those are the things. So you need to know the cause, the risk factors, as much as possible to be able to avoid them. So those are the things for the
complications that could arise.
Okay, so
from lack of treatment or treatment, but complications still came.
Okay, so the complications that will arise are mainly from lack of treatment. Okay, because it's treatable if you know the symptoms. If you go seek medical help, it's treatable. But if you don't, if you only have complications. Okay, so when we say somebody has a recurrent infection, if you've had urinary tract infection for twice or more within 6 months, it's a recurrent infection. But if you have it 3 times or more within a year, it's also a recurrent infection. So the complications will include, first and foremost, because it has gotten to the bladder stage, it can actually cause a problem. You can actually have blockage. Okay, for men, for instance, because they've been having urinary tract infection and not being properly treated, you can have strictures. Yes, you can have strictures. Then you can actually have blood coming out. And that actually can have a major challenge for the woman. Even infertility. Okay, because women that are pregnant that have a urinary tract infection, it can actually lead to miscarriages. And those, some of them may even have low birth weight babies. Those are some of the complications. Have low birth weight babies. Then, of course, I already talked about blood, okay? So these are some of the things that can come.
So what are the preventive measures, basically, that for our audience and anybody watching us now, what are the 1, 2, 3 things that they should do, apart from rehydrating, not having multiple partners? What are the other preventive measures that we should?
First and foremost, proper hygiene.
Okay.
Proper hygiene. When you use the restroom, use water. If water is not available and you need to use the tissue, when you're wiping from front, you wipe from front back because of the back passage.
Not the
other way around. Then we already talked about rehydration, proper hygiene. Then for the females, don't use creams. Don't.
Or even if you minimize moderation.
Yes, even some contraceptives.
Truly.
Yes, some contraceptives can also cause it. So basically, those are the things that you should do. The risk factors. Okay, so if you are diabetic, try as much as possible to ensure that you are using your medication properly, and you are also taking very good care of your hygiene.
So what are your last words for anyone watching us now?
Okay, so for everyone that is watching, urinary tract infection, also known as UTI, though it's very common among the females, is treatable. It's treatable. When you have these symptoms, burning sensation, you pass this urine and you find it difficult. At times you can't even hold the urine. The urge is there to go past urine, but when you go, it's so small that you're having fever, you're having rigor, you're having vomiting. All I want to say is that urinary tract infection is treatable. It is when you don't treat it and the complications set in, that's where you can have real major challenge. It can be very annoying. It can be very annoying when you have a urinary tract infection. Then try as much as possible to take water. Drink, rehydrate properly, okay? And for females, those that are menopausal, know that it's part of it, but you should be able to cope with it and manage it. Use your medications when they find out that you actually have a UTI.
Thank you so much for this brilliant, awareness that we are creating. And of course, this is the reason why we have the physicians. We are here to, minimize misinformation, reduce it if possible, and let people know that these medical conditions or anything that regarding our health, when you come to the physicians, you are getting the right information as it is. Dr. Martina in the studio with me has talked about everything concerning urinary tract infection. From the symptoms, the fever, feeling as if you want to vomit or even vomiting, from the pain in your side if it is affecting the kidneys, from even the cloudy urine if it's affecting the bladder. Sometimes it may be bloody urine because if the infection is high up there. Women, we are more exposed than the men, so when you go to the restroom and you do the big number 2, make sure you wipe from front to the back. Don't wipe from the back to the front because you are going to move that bacteria into the tract and then you can have infection. For women that are older, it's part of aging, estrogen level has gone down and then you can have urinary tract infection. So please, as much as possible, hydrate well, ensure you have proper hygiene, and of course, if you have multiple sex partners, reduce it. Until next time, my name is Dr. Memuna Yusuf Kadri, and please be kind to follow us on all our various social media platforms. Remain blessed.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.